Fat transfer has been used in medicine for a long time, but it's now being used in breast augmentation to increase the size of breasts without breast implants. So what's your take on this, Dr. Hawes? Is this real?
I have seen 2 patients just in the last week who have had complications from cutting out fat necrosis. And in my community, it's primarily non-core providers, non-plastic surgeons who can't get their hands on a breast implant. Fat is great for small areas, for contouring, for hiding an implant ripple or wrinkle. I don't believe in it for breast augmentation.
There are rare exceptions where I think it's a good idea, and it's a very small percentage of patients. We get asked about this frequently, but in a patient who's having liposuction, has relatively small breasts and wants to see a modest change, so someone who would want a very small implant who is willing to have liposuction in several areas, I think that's the kind of person that works in.
Define modest change. Are we talking a full cup?
Maybe a cup size. Yeah.
I think as a surgeon you have to be very honest with your patient about the result they can achieve. I say 90% of patients who are coming in for breast augmentation are looking for a fuller shape. But if you're having a modest change, it's important as a plastic surgeon to say, if you have this procedure, there's going to be a very modest, possibly negligible change. And if you're okay paying for that, then let's move forward. If you're looking for something more important, more larger change, I think it's important to consider that implant so that they're educated on both aspects of it.
Yeah. You know, I think that breast augmentation with fat grafting is possible, it's just not practical. It requires multiple procedures to gain large volumes, and I think that fat grafting for breast works great. I think it's the state of the art for breast reconstruction to improve contour. If you need a little bump there, a little fill there, a little bit of fat grafting is a nice enhancement procedure. But as a primary procedure for breast augmentation, it's a long run for a short slide.
That was an interesting discussion. Thank you very much. For the very latest on breast augmentation, visit theplasticsurgerychannel.com.